Om Dhanvantari Namaha. Shri Gurubhyo Namaha. Namaste and a very warm welcome to this wonderful session. I am Dr. Ishwari and I am honored to be your host today for this enlightening webinar on Ayurveda practice, beautifully organized by the team Ayuryana. With humility and respect, I bow down to all the revered gurus and esteemed guests present here today. A very warm welcome to our distinguished guest, Dr. Amogh Alekal, the organizer, Dr. Chada Chetana, and our enthusiastic audience to today's session. I would like to introduce Ayuryana. Ayuryana is a holistic platform that brings together diverse activities fostering a unique blend of learning, exploration, and community engagement. Its initiatives includes online and offline classes and workshops, informative articles and health tips, health-focused camps and events, recreational activities and excursions for students, individuals with physical challenges, seniors, and general public. Sustainable tourism programs such as ecotourism and agritourism. Ayuryana proudly blend tradition with innovation. Events and activities incorporate traditional practice, local cuisines, and rural games. It's inspired by the timeless principles of Ayurveda, thread moral, cultural, and traditional values into every experience, creating a rich tapestry of heritage and wellness. Now, I would like to brief about webinar. Webinar series on Ayurveda practice is a free webinar series conducting on every weekend for an hour, which is telecasted live on Ayuryana YouTube channel. Don't forget to like, share, and subscribe the channel. The motto is to empower the Ayuryana fraternity to excel in clinical practice and sustainability through innovative approaches in Ayurveda entrepreneurship. Now, I request Dr. Radha ma'am to introduce our today's speaker, Dr. Amogh Alekal.
Thank you, Dr. Ishwari. I'm proud to share Dr. Amogh's impressive credentials and achievements, which serve as a testament to his dedication and expertise in the field of Ayurveda. Dr. Amogh A. Alekal from Sorba Taluk completed UG from Sri Raghavendra Ayurveda College, Malladihalli, PG from DGM College, Gadak in the subject Panchakarma. Currently working as an assistant professor at Sri Dhanvantri Ayurveda College Hospital and Research Center, Siddhapura. Also running Suveda Healthcare at Soraba, a Panchakarma setup since 3 years. Monthly 450 plus patients he is consulting and done 250 plus Panchakarma treatments with minimum charges, which is a great achievement in his very engaged. A very good Ayurveda practitioner and a teacher too. He has become a role model to many. I heartily welcome you, Dr. Amogh. I request audience to drop your doubts on chat box. So our sir will clarify at the end. I once again welcome you, Dr. Amogh, and the mic is yours.
Good evening, all. So, in the beginning of the session, I would like to do my salutation to Lord Dhanvantari, all my gurus, and also my teachers and parents. So, the topic, one yoga in 10 diseases. So, it has been selected just to make the students or the practitioners to trust on their Ayurveda practice and to practice Ayurveda with the maximum number of classical drugs. So based on the dosha and the Siddhanta of Samanya Vishesha, so I used to select the drugs, and based on that only, the understanding of the yogas and the indications will be explained in today's session. So as we all know, the Chikitsa Chatushpada, so that is Bishak Dravyani Upastha Rogi Pada Chatustayam, Chikitsitasya Nirdishtam, Pratyekam, Tat Chaturgunam. In the sloka, so there will be 4 chatushpadas, that is fourfold classifications of the chikitsa, so which is must to do a simple chikitsa. So in that, so bishak, upastha, rogi, and also the aushada. So when you thoroughly observe the things, bishak and upastha, so both will be always constant in the chikitsa. So bishak will be having chaturgunas, and as like that, even the upastha. So Dakshastirthartha Shastrarthau, Drishta Karma Shuchir Bishak. So these qualities are must for any physician to practice Ayurveda or any other medicine. Then upastha. So he should have, as explained in Ayurveda, anuraktaha, shutir, daksho, buddhiman, paricharaka. These are the 4 qualities that he or she should possess to be a better upastha or an attendant. But when you observe rogi and aushadha, so aushadha with that bahukalpa, bahuguna, sampanna, yogya guna, even it should possess so many of the qualities, and even it depends upon the every roga and the rogi. The situation makes the aushadha always to change. So in the same way, even the rogi, so he will never be constant. So even though the basic qualities, so that he should possess, with that, even he should be assessed based on the dosha present in him on the particular situation. So as I explained in the below lines, that is rogi. So when a person consisting of, or he is diagnosed with some other roga, so he is called as rogi, that he should possess some lakshanas to consider or to diagnose the particular disease. And that lakshanas always mimics the lakshanas which are present in the dosha. So that I consider as the guna that particular dosha is having. So whether it may be a negative tendency or it may be a positive thing. So when you consider it is a roga, of course, it is the viparita guna of that particular dosha. And then the chikitsa, when you select a chikitsa or the aushada or any dravya that should treat for that particular roga, so that dravya also should possess some of the guna, so which either it should be an opposite guna or it may be a samanya guna that will improve the dosha, or it is the opposite guna that pacifies the dosha. So that is the thing that we need to see when we select a prescription. So then, so dosha, the understanding of dosha in a simple way with respect to guna. So when you observe the picture, so vata, pitta and kapha, the tridosha placement. So in general, in the sharira, so that is below the nabi, there will be vata, and around the nabi, that will be pitta, and above the nabi, so that will be kapha. So when you observe the gunas of the kapha, that is snigdha shito, gurur mandosh, lakshno, mrusna, stiraha kapha. So these are the lakshanas of the kapha dosha. So in that, the snigdha guna, so always, so it is the independent guna of the kapha, but the shita guna, it will be either present in the vata or it will be present in the kapha. So if it is snigdha shita, then it can be considered as the guna or the dosha lakshana of the kapha. If it is ruksha shita, it can be considered as the vata lakshana. So in the same way, so the pitta, so pittam sasneha tikshnoshnam lagu visram saram dramam. So these are the qualities of the pitta. When you slightly observe the qualities of pitta, so you can even observe snigdata, visrata, sarata, and dravata. So these are the qualities of the up mahabhuta, and tikshnata, usnata, and laghu guna. So these are the qualities of the agni mahabhuta. When the Agni Mahabhuta dominates the Apa Mahabhuta, the Pitta slightly starts to change its guna into Agni. And when the Apa Mahabhuta guna like Snigdata, Visrata, Sarata, and Dravata dominates the Tikshna, Ushna, Lagu guna, slightly the Agni which is present in the Sharira, it acts like a Pitta. So, as we all know, the quotation of Vagbhata, so that is how the Agni and the pitta can be differentiated. So vyakta dravatvam and the tyakta dravatvam. Based on this contest, so we can understand whether it is acting like a pitta or a agni. Then the vata. The vata is having tatra ruksho lagushita karaha sukshmaschalaha anilaha. So almost all the gunas except the lagu guna. So all and the Shita guna, all are the independent gunas of the Vata. If it is the Shita, it should be either with the Ruksha or either it should be with the Snigdha. If it is Ruksha Shita, of course, so we can consider the dosha which is present in that particular disease is of Vata. And based on that, so these are the simple example to understand the dosha. And based on that, the different yogas or the treatment protocol can be planned. So in this presentation, so I have selected 7 yogas. So different yogas, like 1 or 2 Churna yogas. So one is like Vati Kalpana, one is like Gugulu Kalpana, and one is Asavarista Kalpana. So even in Churna Yoga, I have also selected one of the Ekamulika Churna Yoga. So this different perspective of my selection is to make you understand with an easy example that how a dravya works in multiple direction. So every yoga consisting of never go and just see the indications of the yoga anytime. Just you should go through the all the ingredients which are present in particular yoga, because every yoga consisting of some ruksha, some snigdha guna dravyas. It is also having of vatahara dravya, pittahara dravya, kafahara dravya. Even it will be having agni deepaka dravya. Even it will be always having rasayana dravya. Most probably all these will be present in every dravya. So when these are the things that will be present in every dravya, so we should not use the dravya just for the purpose of symptomatic approach. We should understand the concept, and based on the need in that particular situation, the dravyas can be selected. So before starting the dravya, so before the every yoga, introduction of every yoga, so I have selected 1 or 2 case presentations. So just you can see that a 18-year-old girl who is complaining of menstrual cramps. Usually the cramp starts before 3 days of her cycle, and she is not even a known case of PCOD, obesity, or anemia. So just she used to feel menstrual cramps so during the cycle, and this cramps and also the pain, so that usually starts before 3 days. When you see the presentation, it clearly shows you, instead of the, so apanamata, you know the importance and also the function of apanamata. So apanamasa always do the shukra artava shakran mudra garbha nishkramana kriya. So that is, this clearly says you the artava to flow in the anulomana gati. So apanamata helps. So when there will be cramps, or so when the patient is devoid of the PCOD or obesity or anemia, any other things, when you have ruled out that, so it is clearly showing that, so it is because of the pratilomana gati of the vata. So the chikitsa should be a tikshna anulomaka. So my drug of choice in this particular case is Hingvastaka Churna. So later we will discuss that and why and all. So the next case, that is a 6-year-old boy who is complaining of irregular bowel movement. So even the bowel which he passes irregularly is having some foul smell, and he even possesses abdominal pain. So 2 hours after the food intake. So he also craves to have sweets regularly. So this particular case, which I saw before 1 or 1.5 months ago, a small boy. So that you, when you observe the symptoms clearly, it shows that, so the Agni-mandya, even the patient is suffering with the helminthiasis, even the creamy. So these are the 2 things that I have observed in the patient. So that too in this condition, so with that Agni-mandya, the Agni-mandya is here because of the Vata and Kapha. So here once again, the Kafahara Tikshna Anulomaka Dravya is the required thing. Even it should be of Krimigna in nature. So for both cases, so I have given Hingvastaka Churna as the drug of choice, and the single dravya is used to treat the disease, and even the patient got a good result in with that particular yoga. So when you observe the ingredients which are present in the Hingvastaka Churna, that is Trikatu, Ajamoda, Saindhava, Jeeraka Dvaya. So you might have seen that Jeeraka Dravya, Jeeraka Dvaya. So both Jeeraka, it may be Krishna Jeeraka and Shweta Jeeraka, both are Tikshna in nature and Ushna Guna. So it is Pitta Vardaka. So it is always considered as Tikshna Anulomaka. So which is even Kafahara in nature. Even it triggers the Agni. So the Anupana, which is given in the classic, so it has been mentioned in the shloka. So that is Sarpisha. So that is Sarpi is the Anupana, and even it will be given in the Prathama Kavala Bhojana. So in that particular time, it will be given with the Sarpi just to avoid that Tikshnata. so which may harm the Agni and it may increase the Agni. The Samana Agni may disturb and it may convert into a Tikshna Agni. Hence, it will be used as the Anupana. So you can observe the ingredients. So you all know Trikatu, which is basically Usnavirya, improves the enzymatic action and it is Agni Deepaka. So in Ayurveda, so I usually consider Pitta always equal to that of enzymes and also the hormones. Every drugs that increases the Pitta, like it may be Amla Rasa. So all these things, Katu Rasa, this acts like an catalyst which increases the enzymes and even the hormones. So in the way, so it will be acting. Then the next dravya is Ajamoda, which is Vatagna. That too, so it acts on the Amashegata Vata. So in any type of cramps, abdominal cramps, Ajamoda is the best drug of choice. So as a home remedy also, we can use that in the beginning or in the first time or the first in the beginning or the acute condition, you can try with that type of medicine. Then it is having Solagna and even Krimigna in nature. Then the Saindavalamana. So you may observe that. So that is having the Kapha Vilayana action and even it is Vibandagna. So the Hingvastakacharana in Vata Kafaja Vibanda, it can be used as the Anulomaka and also the Vibandagna. And then Jirakadvaya, already it has been mentioned, even it is having the Krimihara Guna. And the last one, and but not the least one, so and it is also the main ingredient of the particular yoga, that is Hingu. So it is Deepaka, it is Shwasahara, it is Kapha, Chedaniya Guna. Even it is the Tikshna Anulomaka. So even it is Chakshushya and Krimigna. So Doshagnata, when you observe, so this Hingvastaka Churna acts on both Vata and Kapha and it stimulates the Agni. So in this presentation, so all the yogas, usually the normal indications which has been theoretically explained, so we will be knowing. So instead of that or with that, so I want to explain you about some of the indication that I use in my clinic other than that of the classical explanations. So the clinical application of this Hingvastaka Churna. The first one is menstrual cramps. So you have already seen the case which I have explained in the beginning of the session. So there, the Tikshna Anulamaka, when it is required, when the patient is not a known case of that PCOD or obesity or anemia. So in that condition, if she is feeling the same cramps, so you can go with the Hingvastaka Churna and you can go with the Sukhosna Jala as the Anupana also. So if the patient is Sukumara or Pitta Prakriti in nature, then you can't go with that type of Anupana. Instead of that, so as per the classical reference, Grita in the Pratama Kavala you can use. Then Ruchya. So I have already said you. So in that particular yoga, Saindava, Hingu. So these are the things which stimulates the Agni and even it works like a catalyst which stimulate the enzymes or the Agni. So in that condition, so it can be also used as the Agni Deepaka. Even in many of the conditions like Amamata, so if the patient is not with the Pitta Prakriti, I used to give Hingvastaka Churna repeatedly to just chew. A pinch of Hingvastaka Churna will be given to keep in the patient's mouth and he or she can drink some water. So it can be repeated or frequently. So he can take the same thing just to improve the Agni. So even it improves the taste. The next thing is Khasa. As it is Kapha Vilayanartha, all the dravyas like Trikatu, Saindava, Hingu. So it can be even used as the Kasagna. And toothache. So in many of the conditions in clinics, so we used to get the toothache patients. So in acute condition, so later, of course, it can be referred. And in the beginning stage, so Hingvastaka Churna works beautifully and it can be used with either Lavanga Taila or if you feel for the patient, it becomes more Tiksna and with the Nimbu Swaras also, the Hingvastaka Churna can be mixed and it can be applied in that particular area of tooth and it gives beautiful result. Then yeah, of course, anti-helminthic. So in the second case I have mentioned, so that Krimihara property of Hingu, Ajamoda, so can be used as a better antihelminthic in this condition. Then arthritis, cervical spondylosis and lumbar spondylosis, where there will be kaphavrata vata will be present in that particular condition. So anulomanartha, the two tikshna anulomanartha, hingvastaka churna, you might have seen in clinics, the patient used to come and complain that, so nange kasat samasya ide, so I used to feel frequent pain, and it will be not a stable one. It will be frequently changing. The area of pain will be always changing. So in that condition, Hingvastaka Churna frankly works very beautifully than any other dravya. But the thing is, the patient should be not of any Pitta Prakriti gunas. That's all. Otherwise, it works well. Then next one is Dhatugata Ama. Of course, in the previous cases I said you, so in Amamata it can be given for the purpose of Ruchi in the same way, and with the Ushnodaka it can be repeatedly given. So just it removes the Dhatugata Ama and it helps to relieves the acute pain in Amavata. Then the Hingvastaka Churna, even in the Panchakarma. So in my setup, usually, so when the patient comes with acute constipation, if it is because of Vata Kapha, I used to go with the Churna Basti. So that is also considered as a Ruksha or Lekaka Basti. In that condition, so I used to mix Hingvastaka Churna with Ushnodaka, and instantly I used to give that in form of Basti, and patient feels much relaxed than that of any other internal yoga. So in that particular condition, so the basti, when the patient will be unable to even get jirna of that internal medicine, so you can directly go with the Hingvastaka Churna basti. So the next one, so next case presentation, a 30-year-old male, so complaints of lack of appetite, aversion towards the food, and he also feels nausea. So since 3 months. So nothing significant on his investigation. So in the basic investigation clearly mentions there is no other morbidity. So in that condition, so you just think, so which is the drug of choice, and even the dosha which is present in that particular case. So the lack of appetite, so aversion towards food and nausea. So this clearly gives you a clue about the particular dosha which is present in this particular case. And the next one is a 16-year girl with a known case of leukorrhea. So she complains of white discharge with burning sensation, irritation, and even a localized inflammation or the swelling is there, and redness in the genital area. And her urine analysis shows nothing significant. So both cases, when you observe clearly, both cases clearly shows you the involvement of pitta and even the vata. So most probably the pitta, so doshita pitta. So in this condition, my drug of choice is avipattikara churna. So the avipattikara churna consisting of these ingredients like trikatu, trifala, chaturjata, mustaka, vidanga, trivrut, and almost 50 to 55% of the ingredient consisting of sharkara. So the direct indications you all know. So with respect to the trikatu, trifala, chaturjata and all. So the trikatu is usnavirya. So it also improves the enzymatic action and agni deepaka in nature. Trifala is vatanulomaka. Even it is pramehagna. Even in the Falashruti, it has been mentioned Mehan. So that is, so it is best in Vimshatir Mehan. It can be given in 20 types of Prameha, and which type and when it will be explained later. It can be given in Vibhanda. So Avipattikara is the best choice of drug in Tridoshaja. So basically the Pitta, and even in the condition of Vata or Kapha involvement, if it is there in the Vibhanda, it is the best drug of choice. Then the Krimigna, Srifala is also a Krimigna, and it is even having the Shodhana Guna. So Chaturjata is Agni Deepaka. Mustaka, you all know, it is Katu, Tikta, Kashaya, Rasayukta, Dravya. So it is Lagu, Ruksha and Shita, Shodaka, Lekaka, Kandugna and Krimigna. So Vidanga, best Krimigna, Deepaka, so the crimigna in our classics can be understood as antifungal, antimicrobial, even antioxidant. So Rechaka, so that is Vibandhanrit in the sloka for Vidanga, he explains, Acharya Sharangadara and even the Bhavaprakash explains it is Vibandhanrit and Trivrit. So it is Rechaka, Jvaragna, so all the Slishma Pittahara, Shota and Udara. These are the indications which are classically mentioned. Sharkara, the major ingredient of Avipattikara Churna. So, because of why it is mainly given as Brahmana, Rasayana, even for the purpose of Dhatu Poshana. So, Acharya Bhavaprakash says, Swabhavatava, Sharkara is Swabhavataha Hitakara Dravya. So, it is the best dravya that can be even indicated in children. So, because easily it can be, so that is, it is palatable. Then Madhura, Sushita, Rakta Stambaka. So this is having a Stambana Guna. So you could have observed in the second case. So in Leucaria, so I have used this as the Pitta Stambaka. Then Dhatun Rut, so that is Dahan Rut, Dahan Rut. So it is having the Dahar Shamaka Guna. And even many other things like Kustagna, Vatajakasa, it can be used. Even the Sharkara, so it is the main ingredient that is used in many of the cough syrup as the base. So that clearly says you Sharkara. So not only for the purpose of palatable thing, so even for the purpose of Swabhavataha Hitakara. So hence it is used. Then the classical indications, Amla Pittam Nihanti Ashu Vibandha Malamutrayoho, so Agnimandyam Bhavan Rogan, Nashayet Vikalpataha, Pramehan Vimshatim cha eva Sarva Durnama Nashanam. So it is indicated in Vimshati Prameha, and even it cures all the diseases when you use the particular dravya with respect to the dosha and the needful situation. So Avipattikaram Churnam Agastya Vihitam Shubham. So the doshagnata, as per me, it is tridoshagna. So mainly, of course, it acts on pitta and kapha. So including that, it even acts on the apanavata, and you can even it can be used for the anulomanartha. So the clinical indication which I used to give, so H. pylori infections and alopecia in the chronic condition, it is the best drug of choice that we can use. So it is also having Dahanrit property. So in H. pylori, the patient used to come to you, usually he or she comes to you after the diagnosis only. So in that condition, so when he or she reaches your clinic, so the acute stage will be almost finished, and he or she will be in a chronic stage where daha is the most common symptom. So in that condition, even patients used to complain that the lack of appetite, so nausea. In that condition, avipattikara churna, so even that can be 5 or 10 gram of avipattikara churna can be mixed with a liter of water, and repeatedly it can be given. So in a whole day, the patient should be advised to drink, so that improves the agni and helps for the purpose of pitta shamaka, but the agni deepaka. So that's why I have explained you during the explanation of pitta lakshana. So both agni and apaguna will be there in the pitta. So based on the stimulation, the either it acts like a agni or it acts like a proper pitta. Then alopecia, so both way. So avipattikara churna can be even used like a virechaka dravya or shodhaka dravya, pitta shamaka dravya, or it can be even used for the purpose of application. So that means lekana, for rubbing. The nimbu swarasa will be added, and with the slight avipattikara churna, it can be taken. It can be rubbed on the area of alopecia. So it works very well. So as it is having triphala and all, so vidanga, triphala, so these things work beautifully in that particular condition. Then the next indication is Mutra Krichra and Daha. As I said, it includes 55% of Sharkara. So Sharkara is Madhura, and it is the best Brahmana, it is the best Pitta Shamaka, and in total, Avipattikara stimulates the Apanavata. Hence, so I said you, Shukra Artava Shakran Mutra Garbhanishkramana Kriya. So the Mutra Krichrata, sometimes even the renal calculi, so very minimum sized renal calculi also. So I have seen that. So in clinically, in one of my patient, I have given the Avipattikara Churna for some other condition, but as he or she, so it was not a diagnosed renal calprey case. So with that avipattikara churna, within the second or third day of treatment, even the patient came with that calculus that he said that, so in the urine it was passed. So that is the action of avipattikara churna on the apana vata. Then even it can be given in kasa and shwasa. As you all know, so the Chikitsa Sutra of kasa clearly says you shwasa, that is virechana. So because the udbhavasthana of kapha is that of amashaya, so where which is the adhisthana of agni. So a small correction in the dipana pachana improves the condition of kasa and shwasa. As the avipattikara churna is having the lekhana, kapha lekhana guna, pitta rechana guna, and even it is having vata anulomana guna. So it is used in shwasa and kasa. Even it can be used in tvakvikaras, different tvakvikaras, because of its shodaka and even the pitta shamaka guna. And staulya, in staulya, so it works like deepaka, shamaka, and shodaka. All three multi-dimensional purpose will be served by avipattikara churna. And even it works for the function of ruchi and pakti, and in different allergic conditions. So even it can be that the anupanas like sitophaladi churna and st madhu churna can be used with avipattikara churna. So in my clinic, if it is the pitta dominant thing, I used to mix or add avipattikara churna with st madhu churna, and it will be given in the allergic condition. It may be allergic dermatitis or any other condition, urticaria and all, I used to give. And even in some of the condition, so throat infection, in that condition, even sitophaladi churna mixed with the avipattikara churna can also be given. Then next one is GERD, gastroesophageal reflux disorder. So the first case I discussed with you, somehow it is related to the particular case. So in that condition also, so the avipattikara churna can be used. And even in the vrana, so different types of vrana. So if the patient is non-diabetic, so usually the diabetic ulcer will be in the chronic stage of diabetic. So in the chronic condition, when the glucose level will be very high, so most probably in some of the cases we can use avipattikara churna for sure. So it is indicated there. So even the shloka says the same thing. So later we will discuss that. So in other condition where the rana will be there, the avipattikara churna internally can be used. So it acts like rechaka, shodaka, and even the rana ropa. And Shweta Pradara, we discussed the same case in the previous slide. So even in Shweta Pradara, so it works beautifully. The two in Pittaja Pradara, so that is Pittaja Shweta Pradara, it works very beautifully. So sometimes even Avipattikara so acts on the Dhatugata Ama and the Shweta Pradara, which is responsible for the Dhatukshaya. So that will be stopped. So it acts like a Stambana, it acts like a Shodana, and even it improves the dhatu function. So systemic effect. So we have already discussed almost all the clinical indications, but systematically, so in GI system, it can be used in the clinical explanation also. Sorry, the classical explain also says the same thing. The acid peptic disorder, chronic gastritis, so GERD, and even the constipation, even in many of the metabolic disorder. This metabolic disorder also includes the prameha. The renal system in UTI and nephritis, it can be used. So it is having the Shotahara guna, it is even having the Anulomaka guna. So even it is having the Krimigna guna, and even it is having the Deepaka guna. And diabetes. So diabetics, type 2 diabetes. So Mehan, Pramehan Vimshatim cha eva. So when you thoroughly observe the ingredients or the falashruti of any yoga, so there will be a bunch of diseases. So what it clearly says means the samprapti of the bunch of diseases up to a particular period or up to a particular level, it goes with the same thing or in the same way. So later it starts to deviate from one to other. So till then, the drug of choice should be that particular yoga. So every yoga, you consider any yoga, So some of the yogas from Vataja Vikara till the Kafaja Vikara, so many of the indications will be given. So that is why, so Acharya clearly says, based on the Samprapti Vigatana, so Samprapti Vigatana Meva Chikitsa, they are up to a particular level, the Samprapti moves with the same way. So there the drug of choice will be that particular dravya. Here, Avipattikara Churna mainly works in the Prameha, which is because of the Amla Pitta originated. That is Nidanarthakara Roga. If the Prameha is because of the Amla Pitta, if the Prameha is because of the patient's sedentary lifestyle, food habit, which hampered the Agni and even the Pitta, in that condition, Avipattikara Churna works very beautifully. And even if the RBS level is very high, in that condition also, it can be given if it is because of the Agni or the Pitta. Then, so Vimshati Meha. So when you observe the Prameha, there the involvement of like the Dashadoshas of Prameha, it clearly says the Kleda is included or hampered in all type of Prameha. So Kleda is must for the purpose of Dhatu Poshana. So when you observe the doshas like Kapha, Pitta, Vata, so in the order, the Kleda used to get dry or it used to get reduced, so respectively. So in the Kapha, the Kleda Guna will be more. In the Pitta, the Kleda Guna will be less comparatively Kapha. In Vata, the Kleda will be nil. So how from Kapha to Pitta, Pitta to Vata, the Prameha moves, it goes on becoming Asadhya. So in that particular condition or in the before or the Kafaja and Pittaja condition, usually the Avipattikara Churna works very beautifully. Even in Vataja Prameha, in the beginning avastha, to keep the Kleda alive, the Avipattikara Churna works well. So other than that, so when it is already past all the stages and in the chronic stage of Vataja Prameha, so usually no other dravyas works. So hence in all other condition other than that, Avipattikara Churna can be used. Then the Anupana. So these are the different Anupanas that can be used in administration of Avipattikara Churna like Shitala Jala, Narikilodaka, Madhu, Ghrita, Shira, Punarnamasava. So the above things you might be knowing, but Punarnamasava. So in renal calculi, nephritis, in that condition, it can be the drug of choice as the Anupana with the Avipattikara Churna. So even the Estimadu Churna, Sitophaladi Churna, even the Godanti Basma can be used. Even the Akeka Pisti can be used with Avipattikara Churna in different conditions. So the third yoga, so that is, so later we will see. Now we can see the case. So what can be the simple prescription? So the Garbhini Chardi. So directly I have given the diagnosis. So Garbhini Chardi. So there are two major yogas. Usually we prescribe in Garbhini Chardi. So one is Madhipala Rasayana. The other one is Avipattikara Churna. So other than that, so what we can use in Garbhini Chardi. So that is the third yoga. So we will discuss later. And the third one is, and the second one is a 44-year woman complaining of fatigue on and off. And with that, she also feels muscle cramps frequently. So both condition explain different doshas. In the first condition, it clearly explains you about the Tridosha involvement, mainly the Kapha and Pitta, Dushita Pitta and Dushita Kapha, so will be taken up, or the Pratilomana Gati of the Vata, the Udana Vata takes the Pitta and Kapha in the above direction. And the second case clearly says you about the involvement of Vata that is responsible for the fatigue and even the muscle cramps. In both conditions, the drug of choice will be Sitophaladi Churna. The ingredient says Sitophala Shodasa, that is 16 parts. Then the Vamshaloshana, that is 8 part. Pippali, so that is 4 part. Ela, 2 part. And Tvak, 1 part. Even the Anupana says Madhu Sarpi Yutam Lehan, so that is Madhu and Sarpi are the Anupanas. The ingredients clearly shows you Sitopala, so that is Madura, Sushita, Dahanrut, Pitta Shamaka. Even it can be used in Kustagna, Kandugna. It is the best drug of choice. And Vataja Kasa. It is Brahmana. So it does the Brahmana. So Vamshalochana. So it is used in Madura Kashaya. So it is Madura Kashaya Rasa, Laguruksha Guna, Vata Pitta Shamaka, Kasagna, Jwaragna, Asti Poshaka. Vamshalochana is having Asti Poshaka. So that is why. So we used to give this Sitopaladi Churna even in leukorrhea. Sometimes leukorrhea so clearly says you about the astikshaya. So that is astikshaya lakshana. It clearly says shows you about the astikshaya lakshanas. So in that condition also Sitopaladi Churna can be used even in dhatukshaya. So that is astigata vata. In that condition also for the purpose of brahmana we can use Sitopaladi Churna. So it is also having Vedic Shamatva nature, Vranaropaka, Kesha. So Kesha, you all know that is the so Mala, Dhatu Mala of the Asti. Then the Pippali. So it is Katu, Madhura. So that is Lagu, Tiksna, Anushna Shita Virya. So it is even having Kshaya Paha and Rasayana Guna. And Ela. So Daha, Shwasagna, Angamardagna, Kshaya. So even it is Chardigna. So Ela is mainly used. So there is a home remedy that Ela can be given with Sharkara to chew. So during journey and all, just to avoid the journey sickness. So in that condition or the travel sickness, you can use that particular medicine. So Tvak, it is Katu, Lagu Tiksna, Usna, Vatakapagna. So it can be even used in Pinasa, Aruchi, Krimigna, Kasa, and it is Kanta Shuddhikara. So the doshagnata is Vata, Pitta, Kafahara. So that is Tridoshagna. And clinical indications other than that of the direct referred indication. So it is used in Dhatukshaya. So it is Deepaka, it is Brahmana. So 50% of the ingredient is Sitopala, almost 50%. Hence, it is Brahmana. So it can be used. So you have seen that second case. So fatigue. So muscle cramps. It clearly shows you about the Dhatukshaya because of the Vata, Srota Avaroda. So in that condition, the Sitopaladi Churna with Kshira can be given for the purpose of Brahmana. Then Asti Poshaka, as we all know, so Sitopala and Vamshalochana both are Asti Dhatu Poshana Dravyas. So it can be used in even in the menopausal condition when the patient comes to with the crepitus. So in that condition, so directly instead of diagnosing osteoarthritis and giving other drugs which are the drug of choice for that particular disease, we can go with Sitopaladi Churna with Kshira to improve the condition. And just when the patient is out of that menopausal symptoms or the syndrome, so she will feel much better in that particular condition. So Garbhini Chardi, so as I already discussed, so Kapha Vilayana, so that is Kapha, Pitta and the Udanavata are the responsible factor for the Garbhini Chardi. So that is either maybe because of the Ahara or because of the lifestyle, that is Vihara, or maybe even because of some psychological and the stress related issues. In that condition, so Sitopaladi Churna works very beautifully. So it can be given with Ushnodaka, or even the patient is can be advised and to choose the Sitopaladi Churna so frequently. So it does the Kapha Vilayana, it does the Pitta Shamana, and even it does the Vata Anulomana. Thus, it is the best drug of choice in Garbhini Chardi. And even it is having Sitopala and Sharkara. So as I said, so it is palatable. Then in delayed milestone, for the purpose of Balya and Brahmana, Sitopalaji Churna can be used. So it can be given with Kshira. So even in delayed milestone, it can be used. So allergic dermatitis, Sitopala, so all the ingredient which is having the anti-allergic properties. So it can be used with based on the other dosha. If it is Pitta, you can go with the Estimadu Churna. If it is Kapha, of course, you can go with Sitopaladi Churna. You can add the Avipattikara Churna. So like this, it can be used with the different dravyas and it can be given. And fever, in chronic typhoid fevers, so it acts like a Deepaka, Shodaka, Balya and Brahmana. So most probably in typhoid and such condition, so in the chronic stages, so we need the drug which will do the Brahmana. So for that purpose, so Sitopaladi Churna works well. Then the duodenal ulcer, peptic ulcer, the combinations like Sitophaladi churna with Madhuishti churna, so which is Madhura, Pitta Shamaka and Dhatu Vruddhikara. So that can be used. So the systemic effect. So in respiratory condition, that is, and it works like an anti-inflammatory, antimicrobial, antibacterial. So even it is mild antiviral. So Sitophaladi churna will be frequently given to chew in sore throat. So it can be even given in cough, tuberculosis, bronchitis, even in the GI conditions. So like it is the best appetizer. So it is anti-ulcerogenic, and even in a chronic E. coli infection, it can be given. So as I already said, it is having Vyadik Shamatva guna. So in that condition, so the diseases like rickets, tuberculosis, asthma, so where there will be involvement of IgE. So there, even in the recurrent, so upper respiratory tract infection, in that condition also it can be given. So the anupanas like madhu, grita, ushnodaka, madhu esti churna, avipattikara churna can be mixed and it can be used with sitopaladi churna. Then the next one is, so what can be prescribed in the patient complaints of nausea, loss of appetite, so burning sensation in chest, and he used to feel bitterness of mouth. So during mouthwash and all in the early morning. So you just observe the case, and it will be very common even when we take. So sometimes, so maybe because of the condition and all. So if we take so excessive meal in the night or late meal in the night, in the early morning we used to get the particular symptoms like that bitterness in the mouth. So it clearly says you will the involvement of pitta. So kevala pitta involvement will be there. So in this condition, which will be the drug of choice. And even in the sore throat, so the patient of sore throat since 3 days, so no fever, no myalgia, it's not a known case of hypothyroidism. So in this condition also, sore throat, it clearly says you about the involvement of the pitta. In both condition, the drug of choice will be St. Madhu Churna, which is a Ekamulika Dravya. So you all know, so Madhu St is the best Dravya for the purpose of Pitta Shamaka. It is Madhura, Guru Snigdha and Shita Guna. Hence, it can't be given for more than 3 or 7 days with a direct approach. That means the Churna directly in excess dose for 3 to 4 days is maximum. So more than that, if you go on giving, so it starts to do the Pitta Shamana. And so because of that Guru Snigdha Shita Guna, even it can worsen the condition of the kapha. That is, it may increase the kapha. So it is balya, shukrala, swarya, shotahara. It is having the shodaka guna. So that is doshagnata. So it is mainly vata pitta guna. So other than that of the classical indications, it can be given in acid peptic disorder, GERD, so pitta javrana, so mouth ulcer, because it is sandania. It is the best sandania. It is having rasayana guna, and even it is pitta, rakta and anilajit. So that is pitta, anila, asrajit. That is raktahara guna. So daha, menopausal hot flashes. In that condition, Estu churna with kshira, even St. Madhu churna with saraswata arista can be given. So in chronic stage of H. pylori. So both all avipattikara, so it may be sitophala or it may be even St. Madhu churna based on the condition and dosha. So the dravyas can be selected. In fatty liver, so that is non-alcoholic fatty liver. So the St. Madhu churna can be given. So with the different anupana, it can be given. Then the sore throat. So we already discussed in that condition also it can be given. So in hyperpigmentation, it is best vernia. So it also having the pitta shamaka guna. So that it stimulates, sorry, it suppresses the brajaka pitta which is present in the tvak, and with that, so it improves the complexion of the skin. Hence, it can be used in hyperpigmentation, and it is even present in the Chardigna Gana, hence it can be given in nausea. In early degenerative disorders. So early degenerative disorders include the stimulation or the involvement of pitta. So for the purpose of pitta shamaka, it may be early age graying of hair. So it may be early degenerative joint, anything. So related to dhatu, in that condition it can be given. So the shloka, he Acharya explains it is chakshushya, It is Sandhaniya, it is Medhya, Balya, Shukrala, Keshya, and Rasayana. So these are the proof for which we can use in early degenerative changes. So in Panchakarma, so most probably it will be used in different types of Pittaja conditions. So Dhara, so that is Eshtimadu Kshira Dhara is used even in the hemorrhagic strokes, even in the hypertension, in many conditions, anxiety related issues, neuritis. So we can use that. So Kshira or Kashaya Basti. So even in the Vatarakta, it has been said that Kshira Basti Prakirtitaha. So there even Eshtimadu Kshira Basti can be given. In diabetic ulcers, if the pitta involvement is more, we can use, because it is ranagna, so that is, it is tvachya, it is rasayana, it is sandhaniya, hence estimadu kshirabasti or kashayabasti can be used. So kshirabasti usually we avoid in prameha, but in other ranas we can be used, but the kashayabasti can be used in prameha. So estimadu kshirabasti we can use in hemorrhagic types of stroke. So it works like a sandhana or a stambana. Even in a Vamana, so it is the best drug of choice for Sadyomana. So the first case which I said, so in that condition, Sadyomana with Estimadu was given, and almost 2 to 2.5 years are over. Till now, the patient doesn't complain of that nausea or that bitterness in her mouth. So that is the early morning sickness. It is not there. So that is because of this Estimadu. Even the Lepa, so it can be used in different types of Lepa. So these are the usage of Estimadu Churna in Panchakarma. Then the next drug. So a patient of 35-year-old having sedentary lifestyle, complaining of myalgia, so heaviness of the body, that even the fatigue. So what will be the drug of choice? The second case, a patient having foul breath with normal RBS level. So both condition. So it is here foul smell. So involvement of pitta and even the vata here. So the sedentary lifestyle, which clearly says you about that Agnimandya, so myalgia and heaviness and fatigue. It is because of that Agnimandya, and so there the avarana will be there. And what will be your drug of choice? In that condition, so I used to give Suta Shekara Rasa, the ingredients. So that is Shuddha Parda, all the Rasaushadis like Gandhaka, Tankana Basma, Tamra Basma, Shanka Basma, Swarna Basma. So it is the question, because many of the pharmacies that they are not using Swarna Basma. So Shuddha Vatsanaba, Datura, Trikatu, Chaturjata, Bilva, Kachura, and also Bringarajaswarasa. These are the ingredients. And Acharya explains, so it is Amla Pittagna, Vanti Shula Amaya Paha, Gulma. That is 5 types of Gulma, even it is indicated. Even in the 5 types of Kasa, it is even indicated. Grahani, it is indicated in Atisara. So all the types of Tridoshaja Doshotta, Atisara, it is indicated. Shwasa, Mandagni Nashanaha. So even it is used in Ugrahika, Udavarta, that is Vataja Udavarta, even it can be used. Even in the Pittaja Udavarta, Sutashekara is the best drug of choice. So even Raja Yakshma Haraha, so that is Sakshat, Raso Ayam Sutashekaraha. So Acharya says, so this Sutashekara Rasa acts like a Amruta in many of the diseases. Hence it is called as Sarvarogahara. Even it acts like a Amruta in Raja Yakshma. So because it is used in Dhatugata Pitta Vikara. So the clinical application, other than that of the indications, the theoretical or the classical indication, so it is used in spasm, so muscle spasm, so in primary dysmenorrhea and cramps. So even with the either the PCOD or obesity, even with the anemic. So I already said when it is excluded, so you can go with the Sitopaladi or Avipattikara. So even you can go with the Hingvashtaka Churna. So particularly when it is because of the anemia, when it is because of the PCOD obesity, you can go with the Sutashikara Rasa. In Dhatukshaya, so many of the Dhatukshaya where there will be fatigue, so where there will be muscle cramps, where there will be tiredness, where there will be myalgia, in that condition, the Sutashekara works very beautifully, and it is Brahmana, it is Rasayana. So even with Saraswatarishta, maybe with the Maharasnadi Kashaya, maybe with the Dhanvantara Kashaya, even maybe with Indukanta Kashaya, Sukumara Kashaya, as Anupana, the Sutashekara Rasa can be given. In many Tvakvikaras, Sutashekara is the best drug of choice. So it may be Visarpa, so it may be allergic condition where there will be involvement of Pitta Vata will be there. The Sutashekara works very beautifully. Then hypertension. So as we all know, both the anti-diabetic and anti-hypertensive drugs. So according to even the contemporary ideology, so there are many classifications. So based on that, so Sutashekara. So and even in that mindset also you can think. So in that way also we can use our dravyas to use in that particular diabetes or the hypertension. So here I have mentioned in hypertension, so Shroto Shodaka or Vata Pitta Shamana, according to Ayurveda, so that Sutta Shekara is having the capacity to clear the Dhatu Gata Pitta. So in that condition, it can be given. In many of the conditions, like it may be vertigo, Vata Pitta Ja. So in that condition also, Sutta Shekara is a drug of choice. So diabetic, which is considered as metabolic disorder, so in that condition also, Sutashekara Rasa can be used. In dry cough, of course, so it corrects the Agni and it improves. So it works like a Brahmana. Brahmana is the line of treatment for Kshayaja Kasa and even the Vataja Kasa. In that condition, so dry cough, we can use that. So you all know, somnolic, even anxiety. So that is the patient used to complain that he or she used to talk in sleep. In that condition, so there will be the involvement of dosha is vata and pitta. So Sutashekara is the best drug of choice. So the Anupana like Saraswatarishta works well in this particular condition. And motion sickness, in that condition also, Sutashekara can be given with Ushnodaka, or even it can be given with the Sitophalati Churna. And tachycardia, so it is because of the ama or the emotional stress. Both Sutashekara works very beautifully in both condition, and it can be once again given with Saraswatarishta in this particular condition. Even it can be given with Bhunimbadikada in tachycardia, so that is because of the ama in that condition. So it can be given with Bhunimbadikada. Then the last yoga. So the first case, a 46-year-old lady complaining of hot flashes, so excessive sweating with anxiety, and her RBS, that is border level, it is showing diabetic. So what is your drug of choice? And a second case, a male patient aged about 40 years, so complaining of erectile dysfunction. So he has observed irregular heartbeat after the intercourse. Usually or clearly says you either the Shukrakshaya or Vojokshaya Lakshana. And in the first case, so that is 160, so borderline sugar level. It is maybe because of, so you can see the age 46-year-old, maybe because of that menopausal syndrome. So need not to directly switch on into the diabetic drug, or can't be referred for any contemporary science and all. So it can be easily treated with our science, and so easily can be given the assurance to treat the disease with very basic treatment. And that particular drug of choice is Saraswatarishta. So Acharya clearly says, so how and why it can be used, even the ingredients specifically. So the, as it is having many ingredients, so just for the purpose of briefing, I have mentioned or classified it into many groups like Deepaka Dravyas. So it may be Shunti, Pippali, Tvak, Dhataki or Lavanga. So these are the Deepaniya Gana Dravyas. And the Anulomaka Dravya or the Vatahara Dravyas like Haritaki, Vidanga, Vibhidaki, even the Nirgundi. So Mrudu Virechaka Dravya like Trivrut, even the last course of Dravyas like Brahmi, Shatavari, Vidari, Ashwagandha, Amrita, Vacha, and even in Swarnasa, which is used with gold, Saraswatarishta with gold or the Swarna Yukta. So it acts like a Medhya, Balya, Brahmana, Smriti, Kanti, Rasayana, and all. So Acharya clearly says, so according to me, when you thoroughly go through the shloka, so there is Acharya doesn't left any of the indication that we are using in clinics. But the only thing is, so we should identify the disease, because the classical terms is having many reasons, many understandings. Based on that, we can and we should understand the diseases. Acharya says, Ayurviryam, Smriti, Medham, Balam, Kantim, Vivardaye. So it all says you about the Medhya Guna, Smriti Guna, even the Balya, Brahmana, Tvachya. So all these things, even the Arogya. Then Vag Vishuddhikaro Vrudyo Rasayana Varaha Smritaha. So even it not only for the purpose of speech disturbance, so all the diseases where the speech disturbance is a cause. So it may be delayed milestone, so it may be ADHD, so it may be even stroke. In many of the condition, so it may be in epileptic seizures. In that condition also, so it acts as Rudyo. So it improves us the uh, Paravojas, and even the, so in Ojo Kshaya condition it can be used. Even it can be used in many of the cardiac condition. So even it can be used in diabetic condition. So next Acharya says Bala, Kanti. So it can be given. So even in the Yuna, Ruddha, Bala. So it is Sadahita. In all the age, Saraswatarishta can be given. Even in the Bala it can be indicated. In Yuna it can be indicated. Even in the Vruddha it can be indicated. So Nara Nari Hito Nityam Parama Ojaskaro Mataha. So it is Parama Ojaskara. So that is the reason. So why Saraswatarishta is mainly given in the many of the anxiety issues or the age related issues, like in Ruddha, it may be menopausal syndrome, it may be stroke related issues. So where there the confidence is must needed for the patient. So in that condition, both psychologically and physically, Saraswatarishta is the better drug of choice. Then he also says aspasta cha aspasta bhashanam. So it is also swara karkasham tatha cha aspasta bhashanam. It is used even in the slurred speech, and the patient who is suffering with the speech disorders, in that condition also Saraswatarishta can be given. Swaram parabhrata eva janayet sevanatasta. So even it is indicated in Rajodosha Drishtanam, that is Rajodoshena Dushtanam. So Dushta Raja or the Artava, Yoshitam, Shukra Doshinam. Even it is used in the Shukra Dosha. In Yoshita, it is mainly indicated in Raja and Dushta Artava doshas. And even in the male patients, it can be used for the purpose of Shukra or the Reto dosha. Hence, in the both conditions I have mentioned in the previous slide, so it is both indicated in even menopausal or the Raja or the Artavadushti, menopausal syndrome, even in the Shukra Dushti, which is because of the Shukrakshaya or the Vojokshaya. Then Pumsanjapi Shubhakarha Sarvadoshaharo Mataha. Even it is Sarvadoshahara. So, and even it is indicated in Kshina, Smriti Bala, Naraha. So, where there will be Smriti Kshina and Balakshina will be there it is indicated. And even Acharya explains Chitta Santosha, it gives Chitta. So, that is Labante Chittaha, it gives good Chitta, concentration or the memory. Santosha, so pleasure. Smritincha Asya Nishevana. Even, and it is indicated with the Anupana of Payasa. In many of the condition, even it can be given with the Kshira. If the patient is suffering with the Pittaja disorder or Pitta Prakriti, it can be of course given with Kshira. And even for the purpose of Brahmana, it can be given with Kshira. So, so it is mainly Tridoshahara. Even though it is Asavarista, so the explanation and the ingredients clearly says you it can be used in Sarvaroga based on the condition. So the clinical application that I use to give Saraswatarishta is chronic febrile convulsion. So that is, it improves the Lasika. So Chetavaha Nadi, which is responsible for the febrile convulsion. So that is Chetavaha Nadi and even the Lasika. In both condition, it improves. So it acts like a Brahmana, Balya, Ojaskara and Rasayana. In diabetic 2, type 2 diabetes, in this condition, when the diabetes is because of the age or the menopausal syndrome, when it is because of the stress, when it is because of the anxiety, so in that condition, so Saraswata Arishta works very well. Then in hypertension, so that is menopausal or the marginal hypertension. So in that condition, Saraswata Arishta can be given. And in IBS, irritable bowel syndrome, where there will be Bhayaja or Shokaja Atisara. So in that condition also Sarasvatarishta. Even in the chronic stage of IBS, usually patient, so the psychologically he or she will be depressed, and the frequency of that particular bowel movement is because of that psychological disturbance. In that condition, some assurance with Sarasvatarishta so works very well. Then the alcohol withdrawal symptoms. In even it is the best drug of choice in alcohol withdrawal symptoms. It improves us. So the condition, neurological condition, psychological or psychiatric condition. So it is not only Sharirika Brahmana, it is not only Sharirika Balya, it is not only Sharirika Rasayana, even it is Manasika Balya Brahmana and Rasayana, even it is Ojaskara. Hence, it can be given in alcohol withdrawal symptoms. So Ojokshaya Lakshana. So mainly Murcha, Moha, Pralapa. In that condition also it works. So because of the Parama Ojaskara Guna, so Ojas is the main thing that is involved in Murcha, Moha and Pralapa. In that condition also Sarasvatarishta can be given. So in erectile dysfunction, so it is having Reto or Shukra Dosha Guna, so Shukra Dosha Hara Guna. So in Pumsan Chapi Shubhakaraha. So even in the infertility, Sarasvatarishta can be given. So mainly when the men will be suffering with this particular symptom because of his stress, workload, and tension and all, in that condition, Sarasvatarishta holds good. So in stroke, so where there will be involvement of Vakshad in chronic stage of the stroke. So in the early stage, we used to go with the either the Lekhana, Chedana choice of drug, or we should go with the Sandhaniya or the Stambhana line of Chikitsa. So other than that, in the chronic condition, when there will be speech involvement will be there, memory involvement will be there, in that condition, we can go with the Sarasvatarishta. It is Vak Vishuddhikaro, Rudhyo, Rasayana Varahasmritaha, Kshina Smriti Bala Naraha. So it can be used in Kshina Smriti and Bala. So even the Kshina Smriti Bala and even the Chitta Santoshaha, Smritincha Asya. So it clearly says you the symptoms of Parkinson disease. In that condition also, in the early Parkinson disease, so Sarasvatarishta can be used at least to maintain the disease better than any other drug of choice. So these are the different clinical indications with that theoretical explanation, so that I am using in my particular clinic. So it is not only because of my knowledge, so not only because of my experience, even it is because of the so aptopadesha. So that is in form of discussion with my seniors, my gurus, and with the their approach to different clinical condition. So their advice. So I have tried all these things. So the two mainly, it may be Varun sir and even Patanjali sir's explanation about that Sutta Shekara and Sarasvatarishta made me to read the shloka in better perspective and understand the things better to give in different diseases. So each and everyone. So as I already said in the first slide, so the Chikitsa Siddhanta, so it is mainly depend upon the guna. So even so I want to say that Heturlinga Aushadha Jnanam Swastha Atura Parayanam Trisutram Shashvatam Punyam Bubudeyam Pitamaha. So Acharya says, so Hetu, Linga and Aushadha. So Hetu clearly says you about the Utpatti of the Roga, and Linga clearly says you about the uh, adaptation or the standardization or the presence of the particular roga, and chikitsa which is responsible to treat that particular roga. So all three, hetu, linga and aushadha, this says you the hetu which includes ahara, vihara and manasika, guna. So the samanya guna of ahara is responsible for that particular disease. Samanya guna of vihara and manasika avastha is responsible for that particular disease. And that particular disease which is having the guna or the lakshana of that particular dosha, so that is the thing you should catch and you should diagnose. So more than that of diagnosis, you used to find the dosha which is present in that particular disease, the avastha of that particular disease, the dosha and prakriti of that particular patient, and based on that the chikitsa or the aushadha which is required there based on the guna. So you can identify and you can treat the disease. So it is a long session. I tried my better to explain all the drugs. So, and you can even use the different approach to treat different diseases, and you can get the success in treatment. Thank you.
Thank you, sir. There is a question in chat box. Can you see it, sir?
So, what is the Aushadha Sevana Kala for Avipattikara Churna and Estimadu Churna? So, in the classical reference, it has been said for Avipattikara Churna. So, with the Anupana, so even it can be given before food, that is Abhukta or sorry, after the food. So that is the thing which has been explained. But based on the condition, so for which dosha you are treating the disease, based on that. If the Vipattikara Churna is mainly giving for the pitta, so you can give after 1 hour of food intake. So with Usnodaka and all. So even if you are giving the same thing for the purpose of Brahmana, you can go with the Kshira, and even it can be given before food. So same, Estimado Churna also. Even though in classic it is not clearly mentioned about the kala for Estimado Churna, so based on the dosha and the avastha, so even you can given. So for example, if Estimado Churna you are giving for the purpose of nausea or the vomiting and all, the repeated intake, that is muhur muhur, Aushadha Sevana Kala can be used. If it is for particularly for the purpose of acid peptic disorder or amla pitta, so the choice, if it is sadhya vamana, of course the vamana kala can be used. If it is as the internal medicine, so you can given that, so based on the agni. So if the patient is having a good agni, of course it can be given after the food. So if not, so the patient is advised to maintain the langana, and estimado churna can be given with usnodaka. So like the avastha, Aushadha Sevana Kala is based on the condition and also the drug. Sorry, disease. So I'm maybe there is only one question.
Yes, sir. Thank you, sir.
Okay.
I'm still reeling from the mind blowing session. The insights shared were impressive, empowering, and motivating, inspiring us to think in a new directions. On behalf of Team Ayuryana, I extend heartfelt gratitude to our esteemed guest speaker. Thank you, sir. Huge thanks and a gratitude to the entire Ayuryana team for organizing this incredible webinar. Your collective efforts have made a significant impact. Dhanyavada to each and everyone. Please share, subscribe our channel, like and comment. Thank you, sir.